Quiz. High-flow nasal cannula. AFNC. 1. What is the primary purpose of the heated and humidified air-oxygen mixture in HFNC therapy? A. To cool the patient's airway. To prevent drying of the upper airway mucosa and improve comfort. C. To provide sedation during therapy. D. To increase positive airway pressure. Answer. B. To prevent drying of the upper airway mucosa and improve comfort. Explanation. HFNC systems provide heated and humidified air to maintain comfort and prevent mucosal drying, enhancing patient tolerance. 2. What is one of the key principles behind HFNC? A. To reduce the patient's inspiratory flow demand by matching or exceeding it. B. To replace intubation in all cases of respiratory failure. C. To eliminate the need for oxygen therapy entirely. D. To prevent the use of airway clearance devices. Answer. A. To reduce the patient's inspiratory flow demand by matching or exceeding it. Explanation. HFNC provides a flow rate greater than the patient's inspiratory demand, ensuring delivery of an oxygen-rich mixture without entrainment of room air. 3. Which of the following is an advantage of HFNC over NIPPV? A. Allows patients to eat, drink, and speak comfortably. B. Provides higher airway pressures than CPAP. C. Does not require clinical monitoring. Always prevents the need for intubation. Answer. A. Allows patients to eat, drink, and speak comfortably. Explanation. HFNC avoids the claustrophobic sensation of a face mask, allowing patients to perform activities like eating, drinking, and speaking more easily. 4. Why is it important to monitor for hyperoxia in neonatal patients using HFNC? A. HFNC always delivers low oxygen levels. B. Hyperoxia can lead to barotrauma and other complications. C. Neonates do not require oxygen for therapy. D. HFNC systems do not have humidifiers. Answer. B. Hyperoxia can lead to barotrauma and other complications. Explanation. In neonatal patients, excessive oxygen delivery can cause barotrauma and other risks, particularly if oxygen blenders are not used carefully. 5. HFNC may not be applicable as an alternative to positive pressure ventilation in all situations of respiratory distress. What condition may require CPAP but not the use of HFNC? A. Bronchiolitis with mild hypoxemia. B. Upper airway obstruction or bronchomalacia. C. Mild dyspnea with adequate oxygenation. D. Simple nasal congestion. Answer. B. Upper airway obstruction or bronchomalacia. Explanation. HFNC is not sufficient in conditions requiring high positive airway pressures such as upper airway obstruction or bronchomalacia. 6. Which safety consideration is crucial for HFNC therapy in pediatric and neonatal patients? A. Use the largest nasal prongs available to maximize flow. B. Monitor for excessive positive airway pressures and barotrauma. C. Avoid humidifying the air-oxygen mixture. D. Always set flow below 1 llPa. Answer. B. Monitor for excessive positive airway pressures and barotrauma. Explanation. Improper prong size and excessive flow can lead to barotrauma in pediatric and neonatal patients. 7. What factor suggests a patient receiving HFNC might require enteral feeding through post-pyloric routes? A. Mild respiratory distress with normal vital signs. B. Tachypnea and history of aspiration. Ability to clear secretions. D. Decreased oxygen needs. Answer. B. Tachypnea and history of aspiration. Explanation. Patients with reflux, aspiration risks, or high flow rates may require post-pyloric feeding to avoid complications. 8. Why is clinical education about HFNC important for healthcare staff? A. To recognize HFNC as a basic nasal cannula device. B. To improve understanding of early signs of respiratory failure. C. To discourage the use of HFNC in emergency settings. D. To avoid humidification of oxygen. Answer. B. To improve understanding of early signs of respiratory failure. Explanation. Training ensures early recognition of respiratory failure and proper use of HFNC, preventing its misidentification as a simple device.